once the diagnosis is secure, and that's from blood tests, and also we do a urine test to confirm increased calcium excretion in the urine. So once you're secure with your diagnosis, the main issue is whether the patient has symptoms or not and whether they need intervention. So it tends to be the younger patients with the more severe blood tests and also those with evidence of what we call end organ damage. So for example, if there's clear evidence of damage to the kidneys and the bones, those are the groups of people who are offered intervention. The problem is that surgery is now really the only option, because what you have to do is to find if one or four of the glands is causing the problem and then remove that gland surgically. There is no medical treatment available. So once you make that decision, patients can choose whether or not they want to go forward for an operation, and often in many cases I would advise patients to adopt a conservative approach, because it does appear that many patients can live with a relatively mildly raised calcium for many years without suffering any long-term harm, and it's a perfectly acceptable option to just watch and wait and see if their calcium rises or becomes symptomatic in the future. So the treatment options actually are quite clear. You either opt for surgery with various criteria, or you adopt a wait and see policy to see whether you justify surgery at some point in the future.